Vaginal yeast infection, also known as thrush or candidiasis. This is a condition whereby the female genital tract is infected and inflamed. This is where microbes, infect the vaginal wall and therefore causes itching. Discharge can be thick, creamy, yellowish, and when this discharge is coming out, it comes out with a foul smell. You can sometimes have burning sensation when you urinate or during intercourse. But my dear, don't be scared. Vaginal yeast infection is not an STD, and the fact that you have a yeast infection doesn't mean you are dirty too. So relax. In today's video, I will tell you what vaginal yeast infection is, the causes, the symptoms, the treatment, and most importantly, the prevention, especially if you see yourself treating this vaginal yeast infection over and over again. If you are new to this channel, I am Nurse Sonia. In this channel, I talk about related information on nursing, medicine, and healthcare. Please click on and subscribe, share this video. Don't forget to turn on the notification button so that you'll be notified each time we post educative videos like this. And if you are a returning subscriber, thank you so much for always watching my video. Now let's get straight into the business of today. The vagina harbors many microorganisms. Some of them are lactobacilli and candida species. That lactobacilli is the organism that produces the acid that maintains the vaginal pH, thereby limiting what can survive in the vagina. And we also have the candida species like the candida tropicalis, candida glabrata, and candida albicans. These are natural and good flowers in the vagina. They also live in the vagina. But when the pH of this vagina is altered, these candida develop their disease nature. So when this disease nature is reformed, it forms hyphae, which therefore multiply to secrete enzymes that degrade the epithelial cells of the vagina, which is the vulva, that's the labia majora, that's the lips of the vagina. When this place is inflamed, it therefore causes these symptoms. You now start having mild to severe itching, you have cracks around the lips of the whole of the vagina. So when these cracks happen, anytime you urinate, anytime the urine gets in contact with these cracks, you have pain and peppery sensation, and this also causes the pain you also feel when you're having sexual intercourse. When you're in this is because when time the penis is trying to penetrate into the vagina, it comes in contact with the cracks, which therefore causes this pain. And aside from the pain and the burn sensation, you can also have discharge. It can be yellowish discharge, thick, creamy discharge, and when this discharge comes out, it normally have this kind of foul smell. Apart from the watery and thick yellow discharge, you can also have irritation. That is, you'll be having something like rashes or pimples around your pubic region. So now we're going to go into what causes this yeast infection. The number one thing that causes this yeast infection is the use of antibiotics. Yes, the use of broad spectrum antibiotics. It is true that antibiotics can kill bacteria. Most time it kills also the good bacteria that lives in the body, thereby causing the yeast, those candida, began to multiply and cause infection in the body. So it's not always good to always take antibiotics anyhow you like. So another thing that also causes is this increase in estrogen level. Now studies have shown that most pregnant women is susceptible to this yeast infection during pregnancy because of the increased level of estrogen. This is because the estrogen is also needed to balance the pregnancy hormones. So another people that's also susceptible to this yeast infection is the teenagers. At that puberty stage whereby the body is developing into adulthood, they are susceptible to this yeast infection. Another factor is the immunocompromised. The immunocompromised patients are very susceptible to this infection because of their immune system is weakened due to one sickness or the other. So their body cannot really fight bacteria because of this sickness. And another factor is improper hygiene. People who use soaps, disinfecting wipes, to wash their vagina are prone to this infection because soaps alter the pH of the vagina and can damage the protective mucus that protects the vagina. This then makes it easier for this candida albicans to dominate and cause infection. It is recommended you gently wash your vagina only with warm water, and please, while washing, wash from front to back. like front to back. Don't wash from back to front. This is in order for you to prevent moving bacteria from the anal region to the vagina. When you do that, you push the bacteria, like the microorganisms that lives in the anal region, into the vagina. This will therefore cause infection. So it is recommended while you wash the vagina, wash from front to back. Front to back. Don't forget. Another factor is putting on tight or wet fitting underwears. The vagina needs air to breathe, to keep it in check. So wearing tight and narrow fitting underwears or wearing wet underwears give microorganisms opportunities to operate. They therefore grow, multiply, and therefore start infecting the vagina. Coming down to the treatment, we have the oral tablet. That's a tablet you take in with water to kill the bacteria for you. We also have the creams. In these creams, you apply it on the vulva. That's the labia majora. You apply it on the lips of the vagina, or when you have cracks or you're having painful menstruation, that place is already irritated, so you apply it there. It will help heal and also kill those bacteria that is causing those pains for you. Another one is a supercitru. That's the vaginal tablet. That one, you insert it into the vagina. It normally comes with an applicator, which you put your tablet inside the applicator and insert it into the vagina for it to kill the bacteria. But note one thing: if you're pregnant, please don't use the oral tablet. Visit your doctor or your gynecologist to tell you the best choice for you. Thank you. If you see yourself treating this yeast infection over and over and over again, I have the solution for you. Number one, avoid self-medication. Different antibiotics are made for different purposes. Some of them are bactericidal, that is, they kill the bacteria, while some are bacteriostatic, they only inhibit the growth for a while, and with time it will come up again. Over-the-counter medication may just stop it for a while and it will still reinforce and come back. So visit the hospital for a proper check-up with HVH laboratory diagnosis to detect the particular infection and the appropriate drug to eradicate this particular infection permanently. So if you are just going to the over-the-counter to buy one antibiotics or the other, you may just find yourself treating it over and over again. Do a high vaginal swab examination for them to detect a particular species of microorganism that is disturbing you. After the particular microorganism has been detected, the sensitivity test will then tell the particular drug that will tackle and eradicate the microorganism permanently. So another thing to do if you want to avoid treating this vaginal infection over and over again is avoid incomplete treatment. Minimum duration for this infection varies from 5 days to 40 days or even more, depending on the severity of the infection. So even if you're on the right medication and you did not complete your drugs, that means the infection will do what? Come back again after a while. So always ensure to complete your medication because it's very important. Number 3, avoid reinfection. This is for the sexually active individual. If you took the right drug and completed the dosage, maybe the 14 days, 21 days, and then probably have a partner whom you have consummated with before taking this treatment, and that particular partner has not been treated of the same infection, 101% guarantee that you'll be reinfected with the same infection again. So it is recommended that anytime you are on a treatment for this particular yeast infection, always give the same treatment to your partner. Remember, this drug does not give you immunity over the sickness. It only gives you treatment for that particular time. So your partner needs to be treated in order for both of you to be safe from that infection. And also, anytime you're on this treatment, you and your partner will have to abstain from sex for that period of treatment in order to have a very effective treatment. Number 4, like I said earlier, avoid tight and wet fittings. If you are this kind of person that wash and your panties, your undies are not yet dried and you are doing yourself a harm. Always put on a dry fitting, dry underwears, in order not to give room for these microorganisms to build up, to grow, and therefore cause infection for you. Another one, remember I said earlier, wash from front to back. Front to back. Don't wash from back to front, because if you do back to front, you only bring out the microorganisms that are in your anal region into the vagina and therefore causing infection. So anytime you're washing, wash with only warm water. Only warm water. Don't wash with soap or disinfected napkins and wipes and so on, because they will only alter the pH of the vagina and therefore cause infection for you. Always wash from where? Front to back. Front to back, don't forget. And if you keep all these things that I just told you, the number one, avoiding self-medication, completing your treatment, avoiding infection, stop putting on wet or tight fittings, always wash your vagina from front to back in order to avoid infection moving down from the anal region to the vagina. Always wash with just warm water and not with soap. So with just soap and not antiseptic wipes or any other thing, you'll be fine. Just keep to all the steps that I gave you and be sure to wave bye-bye to recurrent vaginal infection. Now, if you find this video helpful, please don't forget to subscribe, click on the share button, like, and don't forget to turn on the notification bell so that you'll be notified each time we'll come online to share insightful information. And yes, don't forget to drop your comments down on the comment section. Hope to see you on our next video.